As a medical practice owner, are you tired of dealing with scheduling mishaps and patients missing their appointments? Or maybe it's time for an upgrade with the help of AI and this one top secret hack that no one has thought of yet. Patient scheduling is a pain for both the medical practice and the patient. First, your patients frequently have to call to make or change appointments. This means it has to be done during work hours, plus they are frequently put on long holds. And don't get me started on that frustrating phone tree they have to deal with. You know, the one where they have to wait to hear all the options and then select a number? How many of your patients are hanging up before they hear all the options, or worse yet, select an option that then sends them right back to the phone tree voicemail? As a medical practice owner, you end up hiring full-time staff or call centers just to handle appointments. High turnover means constantly needing to retrain new staff on a lot of the rules of the practice, things like billing, regular patient uploads, things of that nature. This is especially if you have not invested in creating a standard operating procedure on bringing on new staff members. There's a ton of lost revenue that happens in the form of patients not showing up or new patients hanging up before even getting scheduled. So, are you ready to dive into how you can transform your medical practice and clinic or process that gets patients in the door? Well, we're going to talk about this today around AI patient call workflows that will transform your practice. Then we'll talk about the people and technology behind patient call workflows and how it's so important to understand the infrastructure. And then finally, we'll talk about the consequences of not starting today. My name is Theo Harvey. I'm a serial entrepreneur. We're from lowly employee to CEO who runs a multi-million-dollar healthcare startup from his home, raised about $1 million from venture capitalists and investors, worked with large organizations like Cisco Systems, AT&T, Charles Barkley Organization, Blue Cross Blue Shield, and Google. My mission is to help healthcare professionals prepare for the new normal in healthcare before it's too late. Let's now discuss patient call workflows that will absolutely transform your practice. Albert Einstein said, "Imagination is everything," is a preview of life's coming attractions. So let's talk through an important workflow that most practices deal with every day: getting new patients scheduled and preparing them for the visit. Medical practices typically lose significant revenue each year due to patient no-shows. The most recent statistic shows that independent physician practices in the U.S. face an estimated annual loss of approximately $150,000 from missed appointments, with each no-show costing the medical practice an average of $200 per appointment slot. Let's say a patient calls to schedule a new patient visit. The voice agent, AI agent in this case, will verify their identity and insurance. Next, this new agent that we'll talk about today will capture the reason for a visit. For example, it could be a new high blood pressure patient who's experiencing their home blood pressure readings are above 140, something around 160 over 100. This is a big deal. Once it gets that information, the AI agent can then book a 30-minute new patient slot. Then it can automatically text intake and parking info to the patient. That's so frustrating. And if you've ever been a patient trying to get parking at some of these clinics or medical practices, they will love you for that simple fact. Finally, if there are red flags, for example, chest pains or neurological deficits, it can provide a warm handoff to start immediately reaching out to staff and label the call urgent triage. What if prior to the appointment, you can also have insurance re-verify before the visit? Between 3 to 5 days before the appointment, the AI agent can absolutely ping a text via or even send a phone call. It can ask the patient to confirm their insurance plan details. If coverage changes, it collects updated info, offers cash pay options per clinic policy. It can even have the patient deal with no-shows for their appointments. This AI agent can absolutely text the patient a one-click reschedule link. That's super important. It can then offer that freed up slot to a waitlisted patient in priority order. Finally, the patient does show up, and now you can create a patient collections follow-up process. After the visit, the AI agent that you will create reaches out to the patients with outstanding balances. It can confirm preferred payment methods, offers to pay securely via links on a phone, and answer common billing questions. These workflows are numerous, right? And this simple workflow can truly transform your practice. Think of all the time and lost revenue that you're losing with not implementing some of these simple workflows. Other workflows could be now tied to quality measures that you get incentive reimbursements for instance, like flu shot outreach or retina detachment risk detection or colorectal outreach. These are all things that you can start to look at to implement and why it's so important. I hope I gave you some thoughts and ideas and run that imagination so that you can begin to think through that process. So here's the action step. Write down your current workflow on patient scheduling. Understand what no-shows are costing you today. If you allow me to take a moment and provide you with a brief public service announcement, we noticed that about 84% of you watch our videos but are not subscribers yet. If you can do me a big favor and take the time to subscribe, as that will help the algorithm reach more people like you. As healthcare is rapidly changing, we all need content like this to really adjust to the new normal. Back to the video. Okay, so let's say you believe that these new solutions can absolutely transform your practice or clinic. So let's talk about how to prepare with the people and technology behind getting patients in the door. In October 2020, the VA launched a massive EHR modernization program. The goal was to move it to a new EHR under Cerner. So they started with the VA Medical Center in Spokane, Washington. So they rushed ahead with the implementation. However, oversight reports and investigative stories have documented that system performance issues and outages began to show up. There were slowing clinical workflows that were not being implemented. There were misidentified patient information, including notes and test results. This is a huge issue. Medication ordering problems. And this is really partly due to like this new complex workflow and interfaces. So the VA ultimately had to pause implementation to better prepare their infrastructure. Look, the point of the story is proper preparation prevents poor performance. Let me say that again. You may have missed a middle P in there. Proper preparation prevents poor performance. The overwhelm can get to you hard, especially when you start a new project and really when you get in these workflows. So I think I have a simple hack that most medical practices that we work with like, and I will talk about a little bit more below. So to prepare to get started in your infrastructure, you have to document simple current workflows. So we're going to take an example of like patient scheduling. I would recommend that you write down patient scheduling journey from the first call with the front desk to arriving to the clinic to getting a call from your back office medical billing team. Think about that. That's that patient journey all the way through. Really understand that. Next, you need to understand the current capabilities of your EMR and make sure it's future-proof with upcoming AI voice agents and AI automation. I know it's a lot to overwhelm, but just understand the basics. Can it make simple call requests? Can it route those calls to someone? Understand that and what the capabilities are. Then finally, you need to start thinking about a dashboard to track the results as you start to go down this journey so that you can see metrics like reclaimed hours and fill rate. So look, you need to make sure that this journey is going to be worth the path, the money you're going to invest up front. Will you get that and even more on the back end? And that's what the dashboards help with. Here's a secret hack I've been hinting at. Hire a virtual assistant to start this documentation process. We have seen this is really effective because, you can hire this inexpensive resource that can do this without taking any time away from your team. And as we know, your staff, they have so many things to do. Another project is going to overwhelm them. And more importantly, this virtual assistant will bring a fresh perspective as documentation is being complete. They can answer questions and be real basic. Bring that beginner mindset to it so they can understand and give you new insight into how these practices, workflows are really working. This info, you would then understand how to actually implement these new patient AI workflows for the maximum impact. It can be daunting to start a new workflow, I get it. So one simple way to get through the overwhelm is to learn best practices from other people via online courses. In fact, we're offering a free masterclass on how these technology can help to grow revenue. Spaces are limited, so if you're interested, go check it out below. Finally, you believe that these workflows can transform your practice and you have the motivation to start preparing, but maybe you are still on the fence about when exactly to start. I would encourage you to start today, and here's why. According to the American Hospital Association, around 30% of surveyed consumers said they selected a new doctor in a recent year, up from roughly 26% a few years earlier. A National Hospital Health System survey found that about 1 in 5 consumers switched doctors in the past year, with nearly 90% saying they left because the organization was hard to deal with. Patients want organizations that are responsive to their needs and easy to work with. I'd like to tell you a story about Dr. Terreri, a doctor out of Middle Georgia that absolutely took advantage of this, right? He had the opportunity to build in a better way to reach out to his patients using remote patient monitoring to kind of communicate to them more effectively. in a rural area. So imagine that. So he was pulmonologist competing with other pulmonologists in the area, but he offered one convenient outlet, ability to provide them with a pulse ox device so that he can understand what was going on with their COPD and track. That one little thing enabled him to onboard thousands of new patients in the span of a year. This is huge. I mean, those that do now won't have to pay later. Let me say that again. Those who do now won't have to pay later. Here's a simple action. Don't implement these strategies and then see what happens to your patient volume. In conclusion, I kind of want to talk about why this is so important to get ahead of these things, because healthcare is changing dramatically and you can absolutely implement this today. We talked a little bit about AI patient call workflows that would absolutely transform your medical practice, thinking of different ways of scheduling, and then also meet some of those quality measurements that you have to get for new incentive reimbursements, thinking through what that reimbursement could look like and what the return on investment will be. Then we talked about the infrastructure, building out the people and technology behind the patient call workflows. One point, I gave you that secret hack, right? That can help you kind of get through that and get that infrastructure understood completely so you can implement it. And then finally, we talked about the consequences of not starting today. Patients are choosing. Let them choose you. So have you started to use AI in your patient communication workflow? If so, leave it in the comments below.